She wants her over here.
Doesn't matter, she's gonna crawl around.
Maddox.
When seconds count. You see someone lying in a ditch unresponsive, or you're at a swimming party and a toddler falls into the swimming pool. Would you know what to do to save them? Studies show that if you are 9 years old, you are old enough to learn and retain CPR. CPR is very important to know, not just for medical workers, but for others as well. There are many instances when someone goes into cardiac arrest in public and medical help is not around. Time is very important when dealing with someone who is not breathing. Permanent brain damage can occur after 4 minutes without oxygen, and death can occur 4 to 6 minutes later. Bystander CPR provided immediately after sudden cardiac arrest can double or triple a person's chance of survival. In adults, some major reasons why a heartbeat or breathing could stop could include drug overdose, excessive bleeding, heart disease such as heart attack or an abnormal heartbeat, infection in the blood, in the bloodstream, injuries or accidents, and in children and infants, some causes could include choking, drowning, excessive bleeding, head trauma, electrical shock, lung disease, poisoning, or suffocation. The symptoms one would show would include difficulty breathing, no pulse, or unresponsiveness. I will demonstrate CPR on an adult and on an infant. Although me demonstrating CPR will not certify you, however, you could greatly increase the victim's chance of survival if you could perform chest compressions until medical help arrives, just to keep the blood circulating. I will begin demonstrating on an adult, unresponsive victim. First of all, you're going to check for responsiveness. You see someone laying here, you check by tapping or shaking them and shout, "Are you okay? Are you okay?" There's no response. Immediately call 911. Carefully place the victim on their back, using 2 people if you suspect there could be a spinal cord injury. First of all, you're going to open their airway by using one forehand on the chin, one hand on the forehead, 2 fingers under the chin. Tilt the head back, and then you are going to look, listen, and feel. So put your ear down to their mouth. You're going to watch for their chest to rise. You're going to feel for breath and air sounds. And if you feel nothing, then you put mouth to mouth. So you put your mouth over their mouth and give 2 quick breaths. Okay. And then you'll watch for their chest to rise. Each breath should take 1 second and make the chest rise. Then you're going to perform your chest compressions. You will go in the center of their chest, between their nipples, and you will place one palm down, place your other palm on top of your first hand, and then place your body directly over your hand. And you are going to give 30 chest compressions fast and hard, and you will go 2 inches into their chest. So you will do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 more rescue breaths, keeping their chin up, head back. 2 rescue breaths. You will continue CPR until the victim recovers or medical help arrives. If the victim recovers, place the victim in recovery position. You turn them on their side, head to the side, on the side. That's the recovery position. Check on them periodically. demonstrate on an unresponsive infant. It's a lot, there's just a few differences with an infant. First, you're going to check responsiveness, so you're going to shout, are you okay? Are you okay? Gently shake the infant and tap them. If there is no response you would be looking for with an infant is just movement or any noises they might make. Do not leave and call 911 until you have performed CPR for 2 minutes on an infant. So if there's no response, you are just going to shout for somebody to call help or perform CPR. First of all, you are going to do the same thing. Hand on the forehead, 2 fingers under the chin. Tilt the head back. Look, listen, and feel. You're looking for the chest rise and feeling for breath sounds. This time on an infant, you will cover their mouth and their nose with your mouth. So you place your mouth directly over theirs and their nose, and then give 2 rescue breaths, each taking 1 second each and making the chest rise. For their chest compressions, you will do 30 chest compressions. You will place 2 fingers, not the palm, 2 fingers on the breastbone just below their nipples. You will keep your body directly in a line with your fingers and give 30 quick and fast and hard chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 rescue breaths. While you're doing your chest compressions, keep their head tilted back. So then you go back to your rescue breaths, covering your nose and your mouth. And then you continue CPR until the victim recovers or medical help arrives. If they recover, you place them in the recovery position as well, on their side, and check on them periodically, making sure they are breathing. Never, ever, ever give chest compressions if the person is breathing, moving, or coughing. Doing so could cause the heart to stop. Never check for a pulse unless you are a healthcare professional.
That's 8 minutes.